Have you ever looked in the mirror and had the terrible feeling that your penis seems smaller than it did a few years ago? Have you noticed that it no longer looks as full when flaccid? Or that your erections don't reach the length and thickness they used to have in your youth? Have you wondered if it's just your imagination, if it's the cold, or if something is really happening in your body that's causing your member to shrink? Do you feel afraid that this process will continue until you lose a significant part of your size and functionality? If you are over 50 and have noticed a visible decrease in the size of your penis, or if you simply want to prevent this from happening, this message is crucial for you. I am Dr. Jocelyn, a specialist in preventive medicine and men's health, and today I am going to reveal to you the uncomfortable but necessary truth about penis shrinkage. Why does it really happen? What are the hidden habits that speed it up? And most importantly, how can you stop this process and unlock your true size once and for all, naturally and scientifically? Stay with me until the end because the solution may be simpler than you think, but it requires immediate action. To understand why the penis can shrink, we first need to debunk a myth. The penis is not a muscle that can atrophy from lack of use in the traditional sense. The penis is a vascular and spongy organ, primarily composed of two cylinders called the corpora cavernosa. These cylinders are made up of erectile tissue, a complex network of empty spaces lined with smooth muscle and endothelium, surrounded by an elastic sheath called the tunica albuginea. The size of your penis, both flaccid and erect, depends almost entirely on the health of these tissues and the amount of blood they can hold. When you are young, these tissues are extremely elastic, rich in collagen and elastin, and your arteries are clear, allowing for massive blood flow that expands the penis to the maximum. However, as the years go by, a series of biological and lifestyle factors begin to attack this structure. Elastic collagen is replaced by rigid, fibrous tissue. The arteries narrow, blood flow decreases, and as a result, the penis loses its ability to stretch and fill completely. This is what you visually perceive as shrinkage. It's not that your penis has disappeared, it has lost its ability to expand and has retracted upon itself due to a lack of oxygenation. And the devastating psychological impact that this progressive shrinkage has on a man is profound. You start to feel less virile, less potent. Every time you go to the bathroom, the sight of a retracted penis reminds you that you are aging, that you are losing abilities. This insecurity transfers to the bedroom. You feel embarrassed to undress in front of your partner. You turn off the light, avoid eye contact. During sexual intercourse, you worry about not satisfying her, not filling her up like before. The anxiety about size kills your erection, and a weak erection makes the penis look even smaller, creating a vicious cycle of failure and frustration. Your partner may notice your emotional withdrawal and think that you are no longer interested in her. The lack of physical intimacy leads to emotional distance, and many solid relationships crack due to unspoken insecurity. Furthermore, physical shrinkage often comes with a decrease in sensitivity and ejaculatory strength, making sex less pleasurable for you. You also feel trapped in a body that is failing you, not knowing that many of the causes of this shrinkage are reversible if you act in time. Many men, in their desperation, seek quick and dangerous solutions. They buy penis extenders that promise miraculous results but can cause nerve injuries and internal scarring if used incorrectly. They undergo lengthening surgeries like suspensory ligament release, which can leave the penis unstable and with permanent erection problems. They inject fillers that can cause deformities, severe infections, and tissue necrosis, or take herbal pills without any health regulation that only serve to empty their wallets. And the vast majority simply resign themselves, thinking it is an inevitable part of aging, and let the process continue until erectile dysfunction becomes total. But before you fall into resignation or dangerous solutions, I want to give you the good news. Penis shrinkage is not a definitive sentence. It is a symptom that something is wrong with your vascular and hormonal health. By correcting the root cause, you can stop the process and even regain some of the lost size. The primary real cause of shrinkage is the lack of oxygenation of the tissues caused by poor circulation. The penis needs oxygen to remain elastic and healthy. This oxygen comes through the blood, mainly during involuntary nighttime erections that occur while you sleep. If you have arteries blocked by cholesterol, hypertension, diabetes, or smoking, oxygenated blood does not reach properly. The oxygen-deprived tissues of the penis undergo a process called cavernous fibrosis. Healthy, smooth muscle cells die and are replaced by rigid, inelastic scar tissue. This fibrous tissue constricts the penis, shortening and narrowing it. The solution here is to recover your cardiovascular health. Quitting smoking is absolutely crucial. Tobacco is the most potent vasoconstrictor that exists and directly damages erectile tissue. Controlling your blood pressure, sugar, and cholesterol is vital, and doing regular cardiovascular exercise is the best medicine. Walking briskly, swimming, or cycling improves systemic blood flow and delivers restorative oxygen to your penis. The second cause is weight gain and suprapubic fat. As I have mentioned in other videos, the fat accumulated in the pubis buries the base of the penis, hiding up to 2 or 3 centimeters of length. But there is something more serious. Visceral fat produces inflammatory substances that attack the vascular endothelium and reduce testosterone. Obesity converts testosterone into estrogen, the female hormone. Low levels of testosterone and high levels of estrogen cause a decrease in libido, and, worse yet, reduce the frequency and quality of nocturnal erections. Without those nightly maintenance erections, the penis does not stretch regularly, which accelerates fibrosis and shrinkage. The solution is clear: lose body fat. An anti-inflammatory diet plan, rich in proteins, healthy fats, and vegetables, combined with strength training, will not only reveal the hidden penis, but also normalize your hormones and reactivate the night repair mechanism. The third cause is prostate surgery. Radical prostatectomy to treat cancer is a procedure that can have significant consequences. It is a known medical fact that many men experience a shortening of the penis by 1 to 2 centimeters after this surgery. This occurs due to damage to the nerves and blood vessels during the operation and the lack of erections in the post-operative period. However, this is not irreversible. Early penile rehabilitation is key. The use of medications like daily low-dose tadalafil and the use of vacuum pumps under medical supervision right after surgery can maintain blood flow, stretch tissues, and prevent fibrosis, minimizing or completely avoiding shrinkage. The fourth cause is Peyronie's disease. This condition is characterized by the formation of hard scar tissue plaques, fibrous plaques beneath the skin of the penis. These plaques cause curvature during erection, pain, and very often shortening and deformity of the penis. Peyronie's disease can be caused by microtrauma during vigorous sex or may have a genetic component. If you notice a new curvature, a hard lump on the penis, or pain during an erection, you should consult a urologist immediately. There are medical treatments, collagenase injections, shockwave therapy, and surgical options that can correct curvature and regain some of the lost length if treated in the early stages. Now let's talk about how to unlock your size and reverse this process. The ultimate strategy is based on 3 pillars: oxygenation, stretching, and hormones. Pillar 1, maximum oxygenation. We've talked about diet and exercise, but you can enhance it with supplements that increase nitric oxide, like L-citrulline and beet juice. These natural vasodilators open the arteries and flood the penis with oxygen-rich blood. Pillar 2, therapeutic stretching. Using a medical-grade vacuum pump, not cheap sex toys, for 10 to 15 minutes a day, 3 to 4 times a week can be very beneficial. The pump creates a vacuum that forces blood into the penis and stretches the tissues in a controlled and safe manner, breaking fibrous microadhesions and stimulating elasticity. It's like doing physical therapy for your penis. Always consult your doctor before using it to learn the correct technique and avoid injuries. Pillar 3, hormonal optimization. Make sure your testosterone levels are in the optimal range for your age. If they are low, supervised hormone replacement therapy can reactivate nocturnal erections and stop atrophy. Imagine Miguel, 58 years old. He noticed that his penis had lost almost 2 centimeters and his erections were weak. He was 12 kilos overweight and pre-diabetic. He was scared. He decided to take action. He started walking 45 minutes daily. He eliminated sugar and refined flours and began taking an L-citrulline supplement. He lost 10 kilos in 4 months. His buried penis reappeared. His sugar levels normalized, improving his circulation. He started using a vacuum pump under the supervision of his urologist to exercise the tissues. 6 months later, Miguel regained not only his previous visible size, but also his erections are firmer than they were a decade ago. There was no magic. There was a commitment to his vascular and metabolic health. It is essential to clarify that unlocking your size does not mean you will grow beyond your original genetics. It means you will regain the size you have lost due to fibrosis, poor circulation, and fat, and you will maximize your erectile potential. If you have severe curvature, persistent pain, or palpable nodules, seek urgent medical attention to rule out advanced Peyronie's disease or tumors. Never attempt aggressive stretching exercises or jelqing that you see on internet forums. They can rupture blood vessels and cause irreversible fibrosis, achieving exactly the opposite of what you are looking for. You don't have to resign yourself to watching your virility shrink day by day. You have the power to stop this process and reverse much of the damage. Your penis is a barometer of your overall health. If it is shrinking, your body is screaming that your arteries and hormones need help. Listen to that signal. Act today. Regain your cardiovascular health, lose that toxic fat, and consider safe vascular rehabilitation therapies. That is choosing to age with power, confidence, and control over your own body. If this information has opened your eyes, if it has given you a clear course of action, leave your like, subscribe to the channel, and share this video. Thousands of men need to know that shrinking is not a sentence, but a reversible warning sign. I am Dr. Jocelyn. Thank you for trusting, for informing yourself, and for taking control of your health. See you soon.